up. We were doing this GRMC segment where we talked about there had been knee and hip replacements, and you heard us talking about it and wanted to call in and let us know how you were doing. How are you doing?
I'm doing well. I'm in good spirits, strong. All my fears were settled.
Were you freaking out about this thing before they replaced your knee?
No, I mentally I've prepared myself. I've had this knee problem going on maybe 45 years.
Mm-hmm.
Injured in high school football. Of course, technology has changed, and I'm walking proof of how much it has changed. I went from X-rays to knee replacement. That was the decision point many years ago, as improvements came in the medical field in this area. It only improved, and this is proof. And so I'm feeling really good about it. Dr. Galang, I think it's a miracle for him to taking an interest in coming to Guam.
Mm-hmm. Now, before this, what led to you? What led to you getting the surgery now?
Okay.
I mean, just that it was here, or how did it work out exactly?
I've actually been working on this actively for about 3 years. 2 years in actually coming to the point of choosing where to have it done. So my decision points were to have it in California or in the Philippines. Both had its upsides and downsides. In California, you're dealing with a big parking lot and inconvenience from family, and all of it having associated with the attendant costs, pre and post surgical. Not to mention the deductibles and things like that. Because if you travel off island, the choice is you have no choice. You really have to bring a handler with you. So, having it on island, having it done on island, support structure is built in. And I can't say enough about the conditions that I was placed here in the hospital. From start to finish, nothing but professionalism, care, the genuine care. There was a little bit of an apprehension on my part because of the youth, the age of these specialists. And those fears were allayed. You kind of look at it as two double-edged sword. You have the youth and their exuberance and diligence to do things, but the sage advice, and that actually came with charge nurses and all the way along the line. So also the technology, it's just incredible. Everything's like wireless, and nothing brings out more fear in a person when you see you have to be hooked up to all of this equipment, and to have it you hooked up and then actually connected via airwaves, Wi-Fi.
Well, it's
incredible.
It sounds like you would give a glowing review, and I appreciate you calling in, Vince, to talk about it. We've got folks here in the studio that we're going to need to talk to, but since you were kind enough to give us a shout, we wanted to be sure and put you to the front of the line, knowing that someone was anxious to talk about the surgery, and it really did happen. Thank you, Vince, again, for calling us.